Hi, my name is Umi Said. I am a fellow from Kenya, Mombasa.
Naitwa Gwakisa Prince Mwaihojo kutoka Tanzania, Dodoma.
My name is Thomas Tumwebaze. I'm from Uganda.
Habari, naitwa Lucian Salama, mmoja kati ya wanufaika wa Build PHED program.
My name is Pamba Umadankan from Kakamega.
Hi, my name is Lucky Namunyak, and part of the second cohort of the East African PHED Fellows.
My name is Hadija Maganga. I build PHED leader from Tanzania.
Hello, my name is Susan Sindani. I am a member of the first cohort for Build PHED leadership program.
Hi everyone, I'm called Mwanaisha Musa from Uganda, and I'm so excited that I got the opportunity to be a part of the Build PHED Leaders program.
Nimeshiriki mafunzo ya PHED, yani Population Health, Environment and Development Integration. Mimi ni mwana mazingira. Kwa kitu ambacho nimejifunza zaidi ni kuhusiana na family planning, kwa sababu mimi nilikuwa sijabobea katika masuala ya family planning. Kwa nimejifunza na nilikuwa nadhana potofu kwamba family planning ni mpango ambao umelenga kupunguza idadi ya watu, lakini ni kiukweli nimejifunza kwamba ni mpango ambao umelenga kubalance mahitaji ya familia pamoja na resources zilizopo katika jamii.
The Build PHED program has been a very good program for me. Intensive 2 weeks of training has made me learn a lot. I used to do activities in my community, especially sexual reproductive health and rights, creating awareness and sensitization to the young people in my community. But after I have come here, I have learned that as much as we are giving out information on reproductive health and giving girls and young women the autonomy to make decisions about when and whether to have children, it's also important to diversify and give them other means that they can learn to also empower themselves economically.
This training was eye-opening, really, because I work for an organization that deals with reproductive health and family planning and population and environment, but differently. We've not been able to integrate these three things. But through this training and these sessions, we were able to actually travel all the way to Samburu County from Machakos, where the training was taking place, and we were able to interact with people who are actually doing PHE, actually in the ground. And we went to Kalama Conservancy, and we got to visit Losaro dispensary, where they are giving different healthcare services, also supported by some funds that are being generated from the Kalama Conservancy. We got to actualize a lot of things that we still think that in these communities are still sort of backwards. When it comes to gender issues, we think that women are still being viewed as people who are supposed to do a lot of domestic works in the homes and all that. But during our interaction, we actually got to see women actually participating in beadwork and are able to get monies that they're able to use to educate their children, which for me was eye-opening, because in Samburu and other pastoralist communities, a lot of women do not have a say in whether their children go to school or whether they don't. But then through these programs where they are able to get an earning from different activities that are being done within the conservancy to support their health, to support the health of their children, to be able to plan for their families and decide on when and whether to get children. For me, that was really eye-opening. The other thing that really worked is that they have bursaries, and these bursaries are from monies that they are able to generate within the Kalama Conservancy, and these bursaries are used to educate members of the community, and they are able to change the lives of those people who are living there. Women and men are also given equal opportunities. We went to a field where different community members were given work, and we could actually see girls and women and men doing the same chores as the others. So for me, that gives me hope. As a Maasai girl coming from Kajiado, that gives me hope that one of these fine days we will have gender equality, and we'll see women getting opportunities of leadership in the communities, and they're able to be part of the change that they would want to see in the communities.
It has been a life-changing training. I have learned a lot. It has changed my mindset. From the perceptions I had right away from home, I can now understand how to integrate population, health, environment, and development in our daily programmings, in our policies. We have been doing this work, but independently. But now we have got a holistic approach.
The benefits of
the integration of PHED leads to the combination of resources which limits silo funding of specific activities, which is a plus because it enables the utilization of resources effectively. And for the FP and the environment coordination, it enables the resource sharing, where we are able to give to have avenues of support which are not siloed but have an integration approach.
We have been moving in where these things were implemented differently. You can't implement these things alone. That's why you see the aspect of population, health, environment are coming together to get in the development aspect of it. I've come here not knowing how the integration works, but I'm leaving fully equipped, being able to go and implement this aspect.
Nashukuru sana kwa hii program kwa sababu nimeweza kupata uelewa mpana kwenye mambo ya PHED, kuwa vinaenda pamoja. Watu wengi tumekuwa tunasahau, tunafanya kazi na environment, tunasahau mambo ya health, tunasahau mambo ya development pia na population. Kwa kupitia hii program nimeweza kupata uelewa mpana sana wa kujua kwamba nikiwa nafanyia kazi environment inabidi pia ni think about health, you think about the population.
So the population health, environment and development approach helps us to just not look at things in a health-wise manner, but rather looking at it in a health-wise manner and also integrating it with maybe environment, so as to ensure that you are solving a problem. And also this is quite cost-effective because most of the times we only tend to do one-off programs, especially in terms of environment. But if we integrate the aspect of health and also environment, we get to save a lot of money because monies will be brought together to implement something that can have a longer shelf life. So meaning longer sustainability, and will be able to help more generations to come.
And I know that that is very important, and that is the approach we should take in our programming, in our communications, and in our advocacy, and in every work that we do. Everybody needs to know this information because we cannot, these things do not work independently. These things are not just hanging in the air. These things are interconnected, are integrated. Even at a personal basis, it is showing me that everything comes with something else. Menstrual hygiene has so many factors to it. It has poverty, it has economic factors to it, it has climate factors to it. The policies they're making at national are affecting someone at a small level. And then climate justice. One thing that really gave me a moment to reflect on is that the funny thing with climate, the climate crisis, is that the people who even contribute less to climate crisis are affected more by it. Actually, they're more vulnerable, and different people adapt differently, and we need to understand that because we have different vulnerabilities. The way climate crisis affects a person with disability is different from the way it affects a woman, it's different from the way it affects a young person, it's different from the way it affects someone living with HIV. And all of this, we need to understand that.
I remember first time joining the fellowship, I had many questions in my head if it's possible to integrate this whole thing together and solve the communities in interconnected way. But the more I had the opportunity to learn, the more I see it's possible and it's actually what the community need. So the perception, the reception of PHED in most of the community, I've actually come to learn that most of people in communities, they are doing PHED without them knowing they are doing PHED. In some areas, people have been implementing different programs together, like environment and health, but without them knowing actually that they are implementing a PHED. But in other communities, it's been very difficult, like, to explain and to introduce it to them. They have like many questioning, asking how is it possible, with what resource can we be able to do it. So it has been a very good experience working with the community, educating them, and telling them it's all possible.
I'm also the team lead for the National PHE Youth Coalition in Kenya, which was an organization that came from the training of the PhD that we underwent in 2023 November. So one of the action plans was to actually mobilize young champions for PhD to form a coalition, which we actually did. And our experience in implementing PhD on the ground has been facilitated by NCPD, National Population Council for Development, under the support of Dr. Ali. They have been a key stakeholder in supporting us, in even reaching out stakeholders that are integrating PhD and being the institution that is providing the oversight for populational issues. So our experience in PhD integration is what we learned in class under the BUILD program really facilitated and informed our interventions. And one thing we have realized is that the Kenyan citizens, especially young people, are very eager to know what PHE is about. And most of them are actually actively implementing different aspects of PHE. You find that youth-led organizations are implementing issues on public health, SRHR, family planning, others are implementing in climate action, others are doing livelihoods, and others are doing other developmental aspects. But what they do not know, they are not aware, is that when you put all those things together, that is what PHE is about. So one of the interventions we are doing as a coalition is mobilizing young champions for PHE, building their capacity to understand PHE concept, and also linking them with institutions that can provide other resources like financial resources.
I think one of the challenges I've been facing as a fellow from Tanzania is that we're actually struggling to have a PhD network where we will engage more with the community and other stakeholders. We will be ready to push the agenda in Tanzania. So we are looking forward to have a network where youth and other people can learn a lot about PhD, how it's work, and how we can all push together the agenda of integrating voluntary family planning, sexual reproductive health, environment, and development.
So one of the challenges has been, as much as the public is curious, they want to understand PHE, their levels of awareness, their understanding, and their capacity of the whole concept is so much limited. And so it makes us go back to the drawing board to come up with the interventions that are aimed to build their capacity. But first of all, we are doing research to just assess their level of awareness so that we can use that information and data to inform the project interventions and see how we can continue elevating the awareness of Kenyans on PHE integration and showing them the value of approaching development from a holistic, whole system thinking while putting family planning, sexual reproductive health at the center of that, and incorporating youth perspectives and gender perspectives for progressive development. I want to thank AFIDEP and USAID and other funders for this program because they believed in us, young people from Kenya, Tanzania and Uganda and other parts of the world, and we are going to carry this vision ahead to make sure that PHE becomes a common concept and a well-practiced culture.
And we need to put more emphasis, we need to put more finances and investment in this. So I'm really glad, I'm really happy that AFIDEP and partners are being intentional about integration, are being intentional about population health, environment and development, because you cannot just have them as independent elements. And so for me, that is the one thing I'm working out with from this, that in the work that I'm doing.
We want to appreciate NCPD because they're the one who provide the framework. Currently, they have established the Kenya National Population Policy for Sustainable Development 2023, of which will give the environment, working environment on the implementation of the aspect of population health and environment.
I'm going back home to make sure that the community I live in, the country I come from, Uganda, has shared from my wisdom I have got from here, and then to ensure that sexual and reproductive health rights are promoted. Many girls have been facing challenges. We didn't know that younger children can also go on family planning. But now we know which types of family planning are best for children, for young girls, and for all those women above the ages.
Niwashukuru facilitators wetu kwa kutusaidia. Natokea taasisi ya maendeleo ya jamii Tengeru, Tanzania. Kwa hiyo ujuzi huu ninalenga kubeba na kupeleka huko nilikotoka. Kwa hiyo namna ambazo ninaweza nikatumia kuchukua ujumbe huu na kuupeleka nyumbani kwangu ni pamoja na kushirikisha vijana katika mitandao ya jamii. Vijana wengi Tanzania wanatumia mitandao ya kijamii, kwa nimeona ni mojawapo ya fursa ya kuweza kutumia mitandao ya kijamii kuweza kuwashirikisha mambo ya msingi. Lakini pia nina platform ambayo ni Tengeru Institute of Community Development, ambapo tuna train vijana. Kwa kupitia platform hii nimeandaa program ambayo ninaweza kutoa public lectures kwa hawa wanafunzi, lakini pia pamoja na staff.
I'm really glad that I got this opportunity to learn, and I'm so excited to tell everyone in Uganda, to tell my community and to everyone I'm working with about integration.